Did you just have ACL reconstruction surgery and you're having too much swelling and it's affecting the way you move and just giving you too much pain? We're going to go over techniques on how to manage your swelling after ACL reconstruction surgery. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. All right, guys, let's jump into it. So before we get started, you need to know that swelling after ACL surgery is a normal thing. It's part of the healing process. You will have swelling. What we're going to talk about right now is having excessive swelling. What we mean by excessive swelling is the swelling affects your ability to do your exercises or do your normal activities or get into walking or activate your quad. When you have too much swelling, that's when we need to really manage the swelling. But swelling, like I mentioned, it's part of the healing process. It's normal process, but we want to just avoid excessive swelling. All right, guys, so before we tackle on excessive swelling, we got to first find out where your excessive swelling is coming from. And most of the time that we see is that people are doing too much too soon. A lot of the times people want to jump into walking without crutches, and that results in their knee not being able to handle that walking or excessive walking to swell up, or they're spending too much time on their feet, or sometimes they go back to work too soon and the knee swells up a little bit more than it should be. When we have that excessive swelling, people are like, oh, it hurts, it affects my ability to walk, and it kind of sets me back. And that's why I usually tell people in the first 2 weeks, these are very critical in trying to reestablish your knee homeostasis, just get the knee calmed down. And the way you're going to do that is by just kind of relaxing and not doing too much early on after ACL reconstruction surgery. Because if you do too much, the knee will swell up. So that's the first thing you got to first address is, are you doing too much? Because the next two reasons we're going to go over is how to really address that excessive swelling once you kind of figure out that you're doing too much. All right, guys, I know this is going to sound kind of counterintuitive, but once we find out if you're doing too much or what are you doing to cause that swelling, the next thing that we really got to start doing is doing some slight little movement. I know you're like, hey, you just said not to do too much too soon, but this movement is going to be more just basic range of motion. So, getting that calf muscle pump working, meaning just even doing just pumps like this with your feet, or just working on your range of motion, bending your knee, extending it. Just simple non-weight bearing movement is huge to help decrease that swelling. So when we talked about the previous one where you're doing too much too soon, it's usually because you're doing more weight bearing exercises, meaning you're walking, you're standing. When we talk about movement and decreased swelling, it's usually the non-weight bearing. So your legs not touching the floor, it's just, you're bending it, you're extending it, you're pushing it up and down. Those are all great movements to help decrease swelling because we want that fluid to expand and go out through our body, not just stay stuck in our knee. And when we're not moving, the swelling just gets worse and worse. So slight little movement with just simple non-weight bearing range of motion exercises are huge to help decrease swelling. And one pro tip that I usually tell people is if you have trouble bending your knee or extending and doing exercise because there's too much pain, one thing that I like to do is having them ice before they do some of these movements, because ice will provide an analgesic effect to help decrease your pain, to allow you to do some slight movement. The ice not necessarily will help with the swelling, but it's going to help decrease the pain to allow you to get some slight movement, which will help with your swelling. All right, guys, the last one to really help that excessive swelling is, and it's a super easy one, it's compression leg sleeves. So we really like the compression leg sleeves because it helps drive the lymphatic system, help drive the whole system to push the fluid up to your heart, get it out of your body. The big thing is you want to have a full leg sleeve, not just one that just covers your knee. You want to go from almost the bottom of your calf all the way to just kind of mid-thigh level. And the reason why is you want that fluid to really have that gradient pressure where it starts kind of tight and then goes tighter and tighter as it's going up and pushing the fluid out. And this is something that you just wear at all times. The first 2 weeks, I usually tell people have that on at all times to really just help the passive movement. But you don't want to just rely on this. You want to do the previous one where we're working on your movement, doing some slight range of motion, activating the foot, calf muscle pump. And also the big thing, all of these won't really work if you're not addressing the first issue, which is why are you having excessive swelling? Are you doing too much? You got to limit the amount of time that you're spending on your feet. Break it up. So instead of just being 1 hour of nonstop walking, maybe you do 5 minutes here, 5 minutes there, and then total up an hour for the entire day or 2 hours, but just break it up in several bouts. And one way you can tell if you're doing too much If you were walking or doing an activity and your knee swells up and it wasn't swollen before you started the activity, that means you did too much. You want to make sure that knee stays in that same current state when you're doing a little activity early on in the first 2 weeks to make sure you're not creating excessive swelling. Hopefully this all makes sense. If you guys have any questions on how to manage swelling, or if you guys want us to go into further detail on breaking up how to really address movement during this period, comment below. We'll try to shoot a video on that, and share this video with friends and family that are dealing with ACL reconstruction swelling after surgery. And if you guys need help with your rehab and are located in Los Angeles or in Orange County area, send us a message. We also work with clients online. So if you guys have any questions or want to work with us, send us an email. We are the Basketball Doctors. Let's ball for life.